Hello, students. Welcome to KENE'S Educare, a group of KENE solutions. This is part 2 of lesson number 13. Why do we fall ill? And in the last part itself, I introduced you about different, you can say, uh, different characteristics, you can say, by which we are falling ill, the reason why we are falling ill. Okay, now just imagine a situation. Imagine what you might have been gone through this. You like we all you all go like went outside for partying and had a food outside. You did your dinner outside, in short. Okay, so as you have done your dinner outside, what you have done is you have eaten many things all together, and that too uh like that too not from that much very hygienic place. Now I also do this because they maintain hygiene, but some or the other, how what happens, some of the unhygienic thing or unhygienic be like you can say material has been added. Like if they are not using proper water, like whatever they are following, whatever ingredients that they are doing, whatever they are doing, that is all good. They are maintaining hygiene with respect to that. But when it comes to water, the water that they are using is not hygienic, it is contaminated. Then at such time, because of that water which was contaminated, you fall ill. Okay, whenever you have an contaminated food or contaminated water, then the chances of getting ill increases. And that is why, if you don't want that you should fall ill, you should always have a hygienic diet, as well as you should always have pure water. Okay, sometimes what we do is when we are hungry or when you are very much thirsty, you just take you tell like "Ki, nahi, nahi, I just need water now, whatever it may so," right? But after that you suffer because of that, because you had anything, it was not hygiene. Okay, I'm not telling that the stalls which are there on the road, they are not maintaining hygienic condition. But with that, what happens is sometimes there are some of the other things which gets contaminated, and that becomes the reason of we falling ill. So these are some of the situations. Then one of the most important symptom which has been observed when we fall ill is the stomach ache because of eating or drinking contaminated food and water. After stomach ache, many people get fever, high fever. Now, why one gets fever is because your body is trying to fight against a bacteria or virus which is not good for you. Okay, now always remember this thing, that fever jo hai, that is a mechanism that your body is using because it wants to kill that bacteria and virus. Unless and until what happens in fever, see, during when you get fever, the body temperature of your body increases, right? The body temperature increases. So under such you can say when the body temperature is increasing, it means your body is trying to fight against the bacteria and viruses so that it can prevent you from the bacteria. And this is a natural defense mechanism. Fever is a natural defense mechanism that our body uses every time. So don't get scared whenever you get fever. You should know that you have some bacteria or something in your body, by which my body is preventing me, and that is the reason I have got this fever. Okay, then these are some of the symptoms. You get headache, you do vomitings when you eat something which was not good for you, when you eat very oily food. You might be remembering some of your days, right? You have eaten a oily food and then you vomited everything. That was all because of something or the other thing. So the diet that we take, that plays a very important role. Now when you go out to play, just imagine the situation. When you go, you went out to play, you played with your friends and everyone. Okay, now after coming from the playground, if you're not washing your hands and you started eating anything, what's going to happen during such event? What do you think? What I'm doing is I went to play on the playground. I played with mud. I played cricket, football, everything. Okay, now I'm not washing my hand. I'm not washing my feet, and I have started eating the snacks when I entered the house. Right. So this is very much wrong, because what happens when you go out? You have certain bacteria, viruses, which gets attached to your body, your hands, and everything. Right, and that is how you're taking that bacteria. You are giving that chance to the bacteria that yes, come attack on me, right? And when they go into your body, what happens? Multiplication, matlab they increase their population, because of which the symptoms starts increasing, and that becomes serious when we don't pay attention on to this small symptoms. Okay, so whenever you go to doctor, the doctor checks and gives you some antibacterials, antibiotics, and all, so that whatever infections has occurred, that can be cured. Okay, so now what we have discussed in the last classes, we have started with the health and its failure, right? We have started like the health and failure has the first topic that comes under it is the significance of the health. Let's study that. So see, the significance of health, it includes like here the health word is being introduced to you because we use this word health frequently. Now, whenever you don't want to go to school, and your mama wants you to go to school, that time what happens? You tell your mama, "Mama, nahi, I'm having a stomach ache today. I'm not going to school, right? My health is not good today." This is what these are the words that we use, right? And even sometimes you fall sick, you're not you can say you're facing some issues, you're having stomach ache, you're having fever. Okay, there are many things that happens to our health. So we mostly know this word is been introduced to you all, I guess, since you were in third and fourth standard when you study your EVS, right? So we have heard the word health quite frequently, है ना? So we use it ourselves as well when we say things like grandpa's health is not good, right? Because grandpa's health, there are more chances, like there are frequent times when grandpa's health is not good because of the age she is in. But she is very much fit than us, she can do more work than us. Okay, and the other examples given as our teacher use it when they scold us saying this is not a healthy attitude. Okay, so our teachers, they also scold us, right? Because if you are not giving the right answers, if you're not studying and you're just enjoying, if you're not studying, that time most of the time teachers tell you, right? If you are telling something in return which shouldn't be told to the teachers, right? That time she tells us that this is not a healthy attitude, you know. Or else when you're not studying and expecting more marks, so that time we have heard this many times that this is not a healthy attitude to follow, right? So what does the word health means according to you? What do you think? What does the word this health means? So if you think about it, you will realize it that health always implies is the idea of being well. Okay, which idea does it implies is being well. Now being well is like, if I am not having any disease, it doesn't mean that I'm healthy. Now I'm not having any disease, it doesn't mean I'm healthy. You're not having any disease, it doesn't mean that you're healthy. If you are physically, mentally, and socially in a state of well-being, then you can say that you are healthy. Okay, so we can think of being well as an effective functioning of our body. Okay, so for our grandmothers, being able to go out to the market or visit to the neighbor is being well. Now our grandmothers, they mostly have some problems, like, so they don't move out, right? They don't move out in the market, they just stay at home, watch movies, watch television serials, right? Then they listen to old songs. Then they, whatever they do, they are inside their house because they think that it's problematic for them to go out. But When they are able to go out to the market, when they are able to visit the neighbors, for them that is being well. Okay. And if they are not able to go out to the market, if they're not able to visit the neighbors also, that time they say that I have a poor health because I'm not able to move, right? So, being interested in following the teaching in the classroom so that we can understand the world is called as a healthy attitude. Now you are very much interested, or I am very much interested in teaching you all, right? So this is my healthy attitude that I'm having. That is a positive attitude that I'm having. Okay? And if I'm not interested in teaching you all, then that is my negative attitude, and that is called as an unhealthy attitude. So always you should have an healthy attitude, and this depends upon the situations. Okay, but try to have this healthy attitude. This is very much important in life. Okay, so how at the end, how can we define health as? Health is therefore a state of being well enough to function well. So a state of where your body is functioning well, your body is in a state of being well. Okay, it is functioning well physically also, mentally also, and socially also. Then we call, then we say that I am healthy if I am physically, mentally, and socially fit. Okay, and I have no issues with respect to any of the things, mentally as well, I'm not mentally disturbed as well. Then we can say that I am healthy. As I told you one sentence, if I'm not having any disease, you cannot call me an healthy individual, because you don't know what mentally I'm going through, or what socially I'm facing a problem with, or what physically I'm facing a problem with. Okay, so we cannot ever say that anyone is healthy unless and until you know that person perfectly, physically, mentally, and socially. Okay, then we discussed on the personal and the community issues. They both matter for health. Now, what we have discussed here, कि यहाँ पे it's not like we individual are only responsible for maintaining ourselves healthy. As I told, that social issue, like if you are socially in a state of well-being, then we call ourselves healthy. So social thing is also social thing comes into picture here, right? So if health means a state of physical, mental, and social well being, it cannot be something that each one of us achieve entirely on our own, right? We cannot achieve this health entirely on our own, because social well being is also associated there, right? So, the health of all organisms will depend on their surrounding on our or their environment. Now, during rainy season or during any other season, it happens that when the environment is changing, when the surrounding is changing, what happens? You see that many people in your area, they start getting ill. They start falling ill. Why is it so? Because the environment where you are living, that is changing, Hannah. Or but what happens, as I have given you an example, that water is getting stagnant over a place. Okay, because of which you see that mosquitoes are coming a lot, because mosquitoes, they increase their population in water by releasing the egg in stagnant water, right? So if no one is taking care of that no one is like seeing out, or no one is taking the responsibility of clearing that stagnant water, the mosquitoes are going to release their egg, and in your area, malaria, dengue, this will be the common thing that the people will be suffering from, right? So not only our health depends on us, but it also depends upon the environment or the surrounding where you are living. Okay, so the environment also includes the physical environment where you live. For example, health is at risk in a cyclone in many ways. Now, suppose in a state there is a cyclone which has occurred. So, during cyclone, the people who are living in that area where cyclone has occurred, the health is at great risk there. Okay. Now, all human beings who live in societies, we all are living in societies, right? So, our social environment is an important factor in our individual life. So the social environment that we are having with the society, with the community, is also very much important factor when it comes to an individual health. Okay. We live in villages, towns or cities, right? And in such places, even our physical environment is decided by our social environment. Now, when it comes to villages, towns, and cities, in such places you will see that the physical environment where you are living, that also depends upon the social environment, because there is a community which has been set up, and that decides that what physical environment should be followed, what rules should be followed, how everything will be done, and everything has been decided socially, right? So here you can consider what will happen if no agency is ensuring that garbage is collected and disposed. Let me give you one example. Suppose in your area, if there is a place where the garbage has been dumped. Okay, every individual in the area goes there and they dump their garbage. But what is happening? Everyone, like, daily everyone is throwing the garbage, but there is no agency who is coming and taking and clearing that garbage from that place. So what will happen if no one is taking the responsibility for clearing the drains and ensuring that the water does not collect in the street or open spaces? Now during rainy season, you know that the roads have certain holes, right? अगर वो roads पे water collect हो रहा है वहाँ पे, no one is taking care of that, what is going to happen? And if there is a great deal of garbage which is thrown in our streets, or if there is an open drain water lining stagnant around where you are living, in all such cases, you will see that the possibility of the poor health increases, because whoever is living, who, like the individual or the community who is living in that society or the area, is going to have poor health, because the possibilities of poor health increases. As I told you that mosquitoes will grow in such areas where the water is being stagnant there, right? So therefore, public cleanliness is important for individual health. What is important? It is not only that our health is important, public cleanliness also plays a very important role here. Okay. So see here, where was I? Hmm. So we need food to be healthy, and this food will have to be earned by doing work. We all are aware of this. Why are we working? Why are we studying? Yes, what do you think? Why are we studying? Because we have to be sure that when we grow up, we can earn enough, we can have a good life, right? And everyone, your father, everyone is struggling. Like when you see everyone around you, you will find that everyone is struggling for some or the other reason, and the most important thing why we struggle is the food, right? So in order to be healthy, we need to have a hygienic food, we need to have a nutritious food, and we will have to earn that by doing work, right? This is the, you can say, one sort of rule that we know, that in order to like have good food and a good life, we need to earn well, right? So for this, the opportunity to do work has to be available. And if you want to earn good, there should be an opportunity where you can work, right? You should have an opportunity that you can do your work, right? So we need to be happy in order to be truly healthy. Now if I want to be healthy, I need to be happy as well, because that is one of the thing which is very much important. If I'm having a healthy diet, I'm having everything, but I am sad, I'm not happy, then you cannot say that I am healthy, because mentally I'm disturbed somewhere. And we have seen that the definition of health itself says that it's a state of physical, mental, and social well being. So, mentally, also, right? So we need to be happy so that we are truly healthy. And if we mistreat each other and we are afraid of each other, we cannot be happy or we cannot be healthy. So we should see to it that we are never mistreating anyone and we are not afraid of anyone. We are all human beings, है ना? We are all human beings. We have to see to it that we are not mistreating anyone and we are not afraid of each other, because why will you be afraid of each other? We are all human beings. And ऐसा तो नहीं है कि if someone is elder than you, then that person or that individual is having something else. No, we are all human beings. We shouldn't be afraid of each other, because if we are afraid of each other, or if you are treating, see, if you are being mistreated, obviously baat hai that you will not be happy, you will be stressed, you will be mentally disturbed, right? But if you are mistreating someone, you enjoy for some moment, but after that what happens again? You are going to be somewhat sad, or mentally you will be thinking something that will have a negative effect on your mind. Okay, so it is very much essential that we are not mistreating anyone, neither we are afraid of anyone. Okay, so your social equality and harmony, these two things are very much necessary for every individual health. Okay, so for maintaining an individual health, there should be in social equality as well as harmony which should be maintained, and we can think of many other such examples where we are having connections between the community issue and the individual health. Okay, this is very much important. Now we have this 5 F's, like what is to be done has been shown here, and how we can prevent the transmission of the disease. Transmission means that the disease is spreading from one individual to another, or disease has started spreading. So how can we prevent this transmission of disease? For preventing this transmission, what is to be done? We need to maintain sanitization and hygiene. What do we need to maintain? Sanitization and hygiene condition. Okay, so what are those 5 F's? I hope you have taken a note of it. The first F is fluid, second is finger, third is flies, fourth is fields, and fifth is floods. Okay, these are the 5 F's that you should know. Now see, these are all connected to the fecal matter, that is the waste product which has been excreted. Okay, so this is related to what? Fecal matter. Now see, what is the hygiene that we can hygienic condition that we can go with when it comes to fluid? So we need to protect the water source. We have river, we have lakes, we have so many things, and we need to protect the water source from wherever we are getting the water, right? So this is the hygiene thing that we need to maintain. Now what kind of sanitization? So we need to treat and store the water safely. Okay, what do we need to do? We need to treat as well as store the water safely. This is the sanitization that we can follow. Okay, after that the second thing is fingers. What it is? Fingers. Now what is the hygiene that you should follow with respect to fingers? You need to wash your hands before preparing and taking the food. Now you don't prepare the food, right? So whoever is preparing the food for you should wash the hand. Mostly mama do that, right? So you will see that before starting preparing the food, she's always going to wash her hands. Okay, so washing the hands before preparing the food, and what you need to do is before you are eating the food, you need to wash your hands. Okay, don't forget this. After that, what is the sanitization that you need to follow? You need to wash your hands after defecation. Whenever you are using the washroom, you need to wash your hand properly. That is very much important. Okay, because that is how also you fall ill, which will not happen. Okay, so you need to properly wash your hands after defecation. Then the third F that we have is the flies. So आप बाहर गए होगे तभी, like in movies also you might have seen, they show many a times the situations where it occurs, that you will see that They were going to a shop, and what happens, they see that the flies come on the top. This mostly occurs in Chota Bheem. If you have seen, तो flies जो है ना वहाँ पे, they keep on moving on the top of the laddus. So that is very much bad for our health, because you know the flies, they come from so many different places, and now if they come and sit on your food, so what happens, the chances of you falling ill, you getting any bacterial, fungal, any infection increases, right? So this thing should not happen. So we need to cover the food for that purpose, right? If we don't want that the flies should sit on the food, because the flies can even sit on this fecal matter, and now they are coming and sitting on the food. So for preventing this thing, what we will have to do, we will have to cover the food, okay? And as well as covering the food is important, but we need to see to it that we are controlling the flies as well, okay? What we need to do, we need to control the flies as well. Okay. And next is the feeds. Now we know that we get the vegetables and the fruits that we are bringing, that is coming from the agricultural field. And you know the practices which occurs during, you can say, in villages, because in villages every one of us don't have okay, as we don't have toilets in every house, what happens is, this fields, that the agricultural fields, people use this field for defecation, right? So what needs to be done in such cases, people should avoid open defecation, they should use toilets for that purpose, okay? As well as what has been given, clean vegetable and fruits before use. Now whatever vegetable and fruits that we are using, we need to clean them, okay? Whenever we are bringing them from the market, we should not consume it like this only. We need to properly wash them, and after that only we should consume that thing, okay? I hope it's clear. Now the last one is the floods, not the fluid, it's the floods. So what needs to be done is, proper drainage system should be maintained, okay? After maintaining this proper drainage system, the treatment of the water should be done, okay? Because there are many, you can say, the water is released from many industrial things as well into the water bodies. So we need to do the proper treatment of the water. So there are many treatment methods, which are biological methods, which are being used. You might not be aware of it now, but you will come to know as and when we start learning more on it, okay? So your H is the hygiene that we need to follow, and S is the sanitization that we need to follow, okay? So these are the 5 F's which are very much important for you all to know. Now we are going to discuss on distinctions that is existing between the healthy and disease free. What did I just say? Distinction between healthy and disease free. So what do you think, what kind of distinction is occurring here? So let me show you. See, if this is what we mean by health, what do we mean by disease? Now health ka definition you already know, where we discussed on that health is a complete state of being like physically, mentally, as well as you can say socially well, socially into a well-being state, right? This is what we discussed on health. So that is what the health means, right? So now what can you say, what do we mean by diseases or disease? The word disease is actually self-explanatory, okay? What disease is actually self-explanatory. because we can think of it as disease, that is a disturbed ease. Can you see disease? These is disturbed and ease. So whatever disturbed we discuss on this, disease itself is self-explanatory in its word. It means disturbed ease, and in other words we can say disease literally means being uncomfortable. So whenever you get any kind of disease, what happens? You become very much uncomfortable, right? You're not able to follow your daily routine. When you have any disease, you don't go to school, you're not able to study as well, you're not able to do your homeworks, right? So that makes the condition very much uncomfortable. Okay. However, the word is used in more limited meaning. It is not like you're getting fever and you're telling that I am having a disease, right? So you cannot say that because the word itself has a limited meaning. Okay, so we have to use it in a more limited meaning here. Okay, so we talk of disease when we can find a specific and a particular cause for discomfort. अब हम डिजीज वर्ड कब डिस्कस करते हैं अबाउट डिजीज, when we can find that there is a specific and a particular cause which is occurring for any of the discomfort, because disease means what? Disturbed ease, right? So when you come to know about a specific or a particular cause why any of the discomfort that you are facing, suppose I'm having stomach ache, I'm having fever, I'm having headache and body pain also. Okay, so if I come to know the reason, like I come to know a specific and a particular cause for this discomfort whatever I'm having, then we can talk with respect to disease, because I said that word disease itself like is used in a more limited meaning. Okay, this does not mean that we have to know the absolute final cause. Okay, इसका मतलब ये नहीं है कि हमें फाइनल कॉज पता करना ही है. We can say that someone is suffering from diarrhea without knowing exactly what has caused the loose motion. Now you know that it's loose motion, and because we call this loose motion as diarrhea. So now you say, instead of saying loose motion, what you say? You just say that the person is suffering from diarrhea. You don't know what has caused diarrhea, right? You are not aware of whether the food that the person has taken, because of that diarrhea has occurred, or because of the other reason the diarrhea has occurred. You cannot say that, right? So simply not being diseased is not the same as being healthy. What has been said? Simply not being diseased is not the same as being healthy. If you're not diseased, it doesn't mean that you're healthy. Okay, because you are suffering from something, as we are not calling it a disease, but still you cannot call yourself healthy at the same time. Okay, so good health for a dancer may mean being able to stretch his body into difficult but graceful positions. Now a dancer, for the dancer, being healthy means if the dancer is able to do a good stretch with his body, it is difficult for that dancer, but he is doing that in a graceful position, then that is a good health for that dancer, right? On the other hand, good health for a musician may mean having enough breathing capacity in his or her lungs, because that musician can control the notes from his or her fluid. So everyone, whatever work that they are doing, if they are able to do it in a good way, nicely, then we say that for them that is their good health. Like as I told you, for dancer के लिए good health क्या है? If the dancer is able to have a stretch gracefully, then the dancer is going to say that I'm having a good health today. Okay, then if a individual who plays a good fluid, or a musician, for them what happens? For them, if the musician is getting an enough breathing capacity in his lungs, then for that musician that is going to be the good health for him. Okay, so to have the opportunity to realize the unique potential in all of us is also necessary for real health. Now because we are getting this opportunity that we can realize the unique potential that we are having within us. Now each of us, we all have some or the other kind of potential, we are good at some or the other thing, right? So if you are getting that opportunity that you can realize ki I'm having a unique potential here, like as I told you for the dancer, if the dancer is able to stretch his body, for him that is the good health for him, because the stretch that he can do, that is a unique potential that the dancer has got, right? So for the dancer, that is going to be the good health. Okay, when it comes to musician, if the musician is having that capacity where he is able to breathe enough by his lungs, okay, and he can control the notes, for that musician, that is going to be the good health. So that is the unique potential that the musician is having, right? So this is all necessary for having a real health. So we can be in poor health without being a simple cause in the form of an identifiable disease. Okay, what is being said in this statement is हम poor health में हो सकते हैं because we don't know the simple cause why that disease is occurred. Now we can identify that disease, but you don't know the cause for it. Like as I told you for diarrhea, you know that the person is having loose motion, you're saying that the person is suffering from diarrhea, but you don't know what is the cause for it, right? So this is a poor health. So this is the reason why when we think about health, we think about societies and communities. Okay. So whenever we are thinking about health, we need to think about societies and communities there. And on the other hand, when we think about diseases, we think about individual sufferers. ठीक है? तो जब भी हम डिजीज के बारे में बात करेंगे, we are going to think about individual sufferer, but when we think about health, we are going to think about the societies and communities. So this is what the distinction occurs between the healthy and disease free people. Okay, got it? What did I just said? Whenever we discuss on health, it comes to, like we are discussing, we are going to think and discuss about the societies as well as the communities. Okay, and whenever we are discussing about disease, we are going to think about an individual sufferer there. Getting my point? Okay, now see, the next topic that we are going to discuss is about the disease and its causes. So here the first topic that comes under the disease and causes is what does disease look like. Okay, after that we will be discussing under this topic acute and chronic disease and how this chronic disease, it has been related to the poor health, and then lastly we will be discussing the causes of infection, then infection and non-infectious causes. Okay, so this is a huge topic, you can say, disease and its causes. So let us just start with the first one. So here the first subtopic that comes under this disease and its causes is, first of all, you should know how a disease look like. Okay, this is a question now we all think of sometimes ki what exactly the disease will be looking like within us, right? So let us now think a little more about diseases. You might be thinking ki ma'am is asking me to just think about diseases, and we all want to stay away from diseases, and I'm telling you to think about it, right? So you don't have to think about with respect to your body, just think about that how these diseases are occurring in any of the individual. Okay, so in the first place, how do we know that there is a disease? अभी अगर किसी को कोई भी individual को disease हुआ है, what do you think how that person come to know that he is suffering from a disease or he might be having a disease? Okay, or in other words, if I say, how do we know that there is something wrong with the body? Yes, this is a question which I should ask you, right? How do you come to know that there is something wrong which is going on with the body? See, there are many tissues in the body, as we have seen in chapter 6, right? We have discussed on different tissues which are present in our body. And how are these tissues made? The tissues are made when a specialized group of cell having the same function and the, you can say, same structure and same function, when they come together, they make up the tissues in our body, right? So we have already discussed on these tissues, right? So these tissues, they make up physiological systems or organ system that is going to carry out the body function. Okay, so the tissues which are present in our body, what do? They are going to make up a physiological system or an organ system. Okay, tissues, what do they make up? See, when a group of cell having a same function and same structure and the function, when they come together, they form the tissue. Okay, and when a group of tissue having the same structure and the same function, when they come together, that makes the organ. Okay, And when a group of organ they are working together, okay, they make the organ system. So what has been said here, the tissues they make up the physiological system or the organ system, and now this organ which has been made by the tissue, they are going to carry out the body functions. Okay, so each of the organ system has specific organs as its part and has its particular function to perform. So each of the organ system that we are having in our body, every like they have specific organ as its parts. So organ system ke andar if I talk about respiration, okay, if I'm talking about respiration, it includes our nostrils, that is our nose, then trachea, then trachea ke baad it in not trachea, larynx, it includes our lungs, right, then we have bronchi, alveoli. So there are different, like if I talk about organ, then nose ho gaya, lungs ho gaya, trachea ho gaya. These are different organs who are coming together, they make up an organ system, and this is how respiration has been done. If I talk about the you can say elementary canal की अगर मैं बात करूँ, how is the elementary canal made? It starts from the mouth itself and ends till anus, right? It is a very long pipe. So elementary canal includes our mouth, it includes pharynx, it includes the the food pipe, that is the pharynx. Okay, food pipe, then it goes to the stomach say it goes to the small intestine, then the large intestine and the anus. So this is how this is called as an organ system which is included, right? But if I like this organ system, they are having specific organs, right? They have stomach, small intestine, large intestine. So they are having this एक पूरे organ system में specific organ है as its part, and every of the organ that we have, now we know the stomach has some of the other function to perform, large intestine, small intestine, they have their particular function to perform, right? So each and every organ in an organ system is going to perform a particular function. Okay, so the digestive system has the stomach and the intestine. So our digestive system has the stomach and intestines, that is small intestine and large intestine, and it is going to help to digest the food which is taken in from outside the body. So whatever food that we are eating, okay, whatsoever food that you are eating, that is going to get digested with the help of your digestive system. Now your digestive system, it includes your stomach, your small intestine, your large intestine, your anus, right? There are different organs which are been involved here. So this was all respect to the digestive system that we have discussed. Okay, now the musculoskeletal system. Okay, musculoskeletal system, which is made up of bones and muscles. Skeleton है musculoskeletal system is made up of what? It is made up of bones and muscles. So this system is going to hold the body parts together, and they are going to help the body move. So how our body parts are holded together? Because of this musculoskeletal system. Okay, what do? They are going to hold the body parts together, and they are going to help the body so that it can move. Okay, and when there is a disease, whenever there is a disease, either you will see that the functioning of one or more system of the body will change for the worse. Now when our body is healthy or it is disease free, that time what happens, all these functions are performed normally. But if you find it that there is something wrong which is going on with your body, see what has been written, when there is a disease, you will see either the functioning of one or more system of your body is changing and it is becoming worse. Okay, that time you can say that you might be suffering from a disease. And these changes that you see in your body with respect to the organ systems, these changes give rise to symptoms and signs of diseases. Okay, these changes are going to give rise to what? They are going to give rise to symptoms and signs of diseases. And we know for every diseases, every individual has to suffer from the signs and symptoms. And when you go to doctor, the doctor asks you certain questions. The doctor asks you, have you vomited, then how is your digestion occurring, okay, how many times you have vomited, are you able to sleep, when are you getting fever, during what time, okay, like at what intervals the fevers are mostly occurring, Okay, and then with respect to the signs and symptoms that you say to the doctor is going to diagnose with something, whatever he feels like, and he's going to tell you to go and have that test done, right? So this is the signs and symptoms that you get in your disease, because there is a change which is taking place with respect to the functioning of the system, right? And this leads to diseases in your body. Okay, so symptoms of diseases are the things we feel as being wrong. Now what are symptoms exactly? Now when you think that this is something wrong which is going on in my body, that is the symptom that you come to know. And so symptom is nothing but the feeling of being something wrong that is going on in your body. Okay, so so we have a headache, we have cough, we have loose motion, we have a wound with pus. These are all symptoms. These are all symptoms of something, that you are having a headache, आपको cough हो रहा है, loose motion हो रहा है. These are what we call as symptoms. Okay, because this is something wrong that is happening with you, right? So this indicates that there may be a disease, but they don't indicate what the disease is. For this only we have doctors, right? We come to know that this is wrong, this is something wrong which is going on with my body. So you go to doctor so that he can diagnose that disease. Okay, so you can feel the symptoms, but your body is not going to indicate you that what the disease you are suffering from, unless and until you are not doing the test and all, right? So, for example, a headache may mean just examination stress, or very rarely it may mean meningitis or any one of a dozen different diseases. Okay, so if any individual is having this headache, now when we have our exam, when we are mentally very much stressed, okay, बहुत ज़्यादा stress होता है हमें we are not taking enough sleep, right? Because we need to study. हमारा eyes जो है that is continuously looking at something, we are not getting enough sleep. We are studying because we haven't studied before, so during the exam time this kind of situations occur, right? So that time having an headache is very much common. You're not going to diagnose that with any disease. Okay, so it can, certain times it can only be an examination stress, or very rarely it may mean meningitis. But if it's meningitis, the symptoms will be different, very different. Okay, or meningitis nahi hai, then any one of a dozen different diseases can be a reason. Okay, if you are thinking too much, that time also headache occurs. So these are very much common. It is not like that if there is a headache you are suffering from a disease. Okay, so signs of diseases are what physicians will look for on the basis of the symptoms. So signs, the physicians are not like whatever symptoms that you are telling the doctor or the physician, that I am having this symptom, I'm having headache, I'm having body pain, I am getting fever as well. So these are the symptoms that you are telling the physician, and the basis of the symptoms that you are saying to the physician is going to look for the signs. Okay, so sign will give a little more definite indication of the presence of a particular disease. So when you say your symptoms, as I told you that the physician is going to find out the signs, right? So now here the physician or the doctor that you are approaching to is going to get more definite indication, because he know the signs and symptoms, which signs and symptoms are seen in which diseases. So he can come up with an indication of the presence of particular disease, and the physician will also get the laboratory test done to pinpoint the disease further. Now he is sure, he is 90% sure that you might be suffering from that disease. That is, if you are having fever and all, that is occurring at an interval, that is it is occurring during night time only, it is occurring at an interval of 2 to 3 hours. So he know that these are the signs and symptoms of malaria or dengue. Okay, so he is going to tell you to go and have this lab test done, so that the endpoint which he is not aware, he is not sure of, he gets sure of, and further he can go on with the treatment. Okay, so I hope you are clear with this, what does the disease exactly look like. Okay, so what did we discuss? Personal and community issues both matter for health, because health may we are looking after the society, okay, as well as the community. But when it comes to disease, we only we only think about the individual sufferer. Okay, So this is what we have discussed on the distinction that is occurring between the health and the disease. Okay, now the next thing that we are going to discuss is about the acute and the chronic disease. So let's see what acute and chronic disease is, or we might continue with this chronic diseases and poor health. Let's see. Now see, acute and chronic diseases. Now when you go more scientifically about telling something about diseases, अगर आप और scientific language में बात करोगे, then we can use the term acute and chronic diseases. These are the two types of diseases that we have. Okay, so the manifestations of disease, they are going to be different, and this is going to depend on the number of factors. Okay, whatever manifestations you have with respect to disease is always going to be different, because this depends on many different factors. Okay, so some diseases, they are going to last only for a very short period of time, and this are called as acute disease. Okay, तो कुछ disease ऐसे होंगे. Okay, whatever manifestations that you are getting with respect to any sort of disease is always going to be different depending upon the number of factors, right? You will see that some diseases, they last for only a very short period of time. So now what is meant by acute disease and chronic diseases? The disease which is lasting for a very short period of time. Okay, what did I just said? The disease which is lasting for a very short period of time, that is, you will be cured within 2 to 3 days, not more than that. That kind of disease we call it as an acute disease, like cold and cough, fever. Okay, so these are the symptoms you can say which last only for few days, right? So whatever kind of diseases that is lasting only for a very short period of time, we call this disease as acute diseases. I want you to write it down in your notebook, that diseases last only for a very short period of time, we call them as acute diseases. Okay, and we all know from experience that common cold lasts only for few days. So common cold is an example of acute disease. So write the definition for acute disease and write the example as common cold. Okay, so the disease which are lasting only for a short period of time, that is what, that is an acute disease. And we are all aware of, कभी अगर आपको खांसी होती है तो what happens, that common cold gets cured within a short period of time, that is few days में, either 2 days 3 days, उससे ज़्यादा common cold रहता नहीं है, right? So this is an acute disease that we are having. And other alignments, it can last for a long time, even as much as a lifetime. And कुछ diseases ऐसे हैं जो बहुत ज़्यादा long time के लिए रहते हैं, and even some of the diseases can be there for the lifetime. And we call such type of diseases as chronic diseases. Okay, so diseases which are lasting for long time, we call them as chronic disease. And an example is infection causing elephantiasis, which is very common in some parts of India. Now there is an infection that causes this elephantiasis, where you might have seen many people who are having their legs like an elephant leg, that swollen legs. Okay, so that is an infection which causes this there is an infection which causes this elephantiasis. Okay, and this is very much common in some parts of India. ठीक है, so this is an example of chronic disease. So I want you to write this, the disease that lasts for a long time, even as much as lifetime, Then we call such type of diseases as chronic disease. And what is an example of it? Infection causing elephantiasis. Okay, please take a note of it. So you are knowing now what is an acute disease and what is an chronic disease. Okay. Okay, so I hope now you know the difference between if I ask you about acute disease and if I ask you about the chronic disease, you are aware of it. Okay, now what we discussed today, let me just show you again. So we discussed on the personal and the community issue, because both personal and community issues matter for our health. Then we discussed on the distinctions that exist between a healthy and disease free. Okay, after that we have started with disease and its causes, where we discussed on the first subtopic, that is what does the disease exactly look like, right? So we discussed on this. After that we discussed on acute and chronic disease. Now in the next part we are going to start with this chronic diseases and poor health. What are we going to start with? Chronic diseases and poor health. So now you know that what exactly is chronic disease. The diseases which are lasting for a long period of time, like an infection causing elephantiasis, that is a chronic disease. Cancer is a chronic disease because that lasts for a lifetime, right? Now there are chances that cancer can get cured because of different therapies, but there are also chances that cannot be cured and it is going to be there for lifetime. Now there are many other infections as well which are being which comes under this chronic diseases. You will come to know when when we study it later. Okay, so we are going to discuss this chronic diseases and poor health in the next class. Then we are also going to discuss on, like we are discussing so many things about diseases, so we should know what are the exact causes of diseases, so that अगर हमें causes पता है कि ऐसे ये disease हो सकता है, we can prevent that, right? Because if we know the causes of disease, the prevention becomes easier. Otherwise what happens, if we are not aware of the causes, we will not be able to come up with the prevention as well, right? So knowing the cause of disease is very much important so that you can prevent that as well. Okay, so we will be discussing that in detail, what are the exact causes of disease. After that we are going to discuss on infectious and non-infectious causes. Now here it is being mentioned as infectious and non-infectious causes, but we have some of the infectious diseases and some of the non-infectious diseases which exist. So we will be discussing on that as well. Okay, infectious and non-infectious disease. So this is the picture which indicates the infectious disease which spreads because of infection. Okay, then infectious diseases may we are going to discuss on what are the different infectious agents which are causing this infectious disease, because as I told you that whenever a disease occurs, you should know ki how the what is the cause of that disease, and you should know how you can prevent that, right? So your infectious diseases occurs because of this infectious agent, so we'll be discussing on this different infectious agents. After that we are going to discuss on the means of spread. Now there is a certain means how the disease is spreading, right? COVID ka bhi to ek mean tha how it was spreading, and it has attacked the whole world, right? So we will be discussing, after discussing the causes, infectious agent, we will be discussing ki how exactly this disease has been spreading from one place to another, how exactly the spread of the disease occurs. Okay, after that we are going to discuss in detail about the organ specific and tissue specific manifestation. Okay, Now, if you remember, we have discussed on manifestation before as well, the manifestation of disease, right? So here we have certain organ specific as well as tissue specific manifestations. So we will be discussing on that in detail as well, organ specific and tissue specific manifestation. Okay. Then after that we have the principles of treatment. What are the different kinds of, what are the principles which are involved in treatment? After discussing on the principles of treatment, we will be discussing on the principles of prevention, because we should be knowing key how the treatment should be. If any person is getting a disease, we should know the prevention for it, and we should also know the principles of treatment as well, because if any of the disease occurs, treatment becomes very important, and prevention of that disease also becomes very important, right? After that we are going to discuss about immunization in detail, because we are falling ill because of the immunity power that we are having. Now immunity is nothing but the capacity that your body is having to be resistant against a particular disease. That is what immunity is, power of resistance to disease. Okay, so immunization is also a most important concept which comes into picture when discussing on why do we fall ill. So we'll be discussing on this immunization as well, and this is how we are going to complete with this lesson, why do we fall ill, by, and we at the end we are going to have a short summary what we have learned from this lesson in short. Okay, we'll be discussing that, and after that we have certain exercise questions which I'm showing you now, so that whenever we are discussing on the exercise, or whenever we are discussing on the same theory, you are aware of that we are having this exercise question back as well, which we are going to discuss on. So please have a look at them carefully. Okay. Please go through them properly. These are some of the questions that we are going to discuss on after we complete studying this lesson, why do we fall ill. Okay, so these are the 6 questions that we are going to discuss on after that. So I hope that whatever we have discussed till now in this part, why do we fall ill, you are clear with it. The rest of the topic which has been left, we will be covering that in the next part. Thank you everyone.